Welcome to the Afterspin. Opinions from thought leaders in our state. Peg O'Connell, Governor McCrory held a press conference a short time ago to address health care issues he would like included in the budget, and specifically included a recommendation of his mental health task force and an additional $30 million for mental health. What do you think about his proposal? Is it enough? What should we be doing to improve mental health?
Well, first of all, I commend the governor for stepping up and starting the conversation about what are we going to do about mental health in North Carolina. For years, we've wrung our hands about it. There's been task force after task force after task force laying out clear plans for what needs to happen. So this is a good start. It's not near enough, but it's a very good start. I think that some of the major things that the task force recommended were things that the Institute of Medicine recommended 10 years ago, places for the mentally ill, people who are living in the community to live. If they don't have places to live, you find them on the streets, and then you find them in jail, or you find them in the emergency room. So case managers to help the mentally ill and the mentally disabled negotiate the very complicated system of health care and mental health care in North Carolina. And that's a very important aspect. I think doing something about the opioid abuse in North Carolina is top of mind with a lot of people, especially with what we've been seeing coming out of the CDC and the huge number of deaths, in Wilmington being sort of ground zero for opioid deaths in the state. There's an interesting thing that was included in the recommendations, which is the ability to allow EMS to find, if they pick up someone who's having a mental health crisis as opposed to a physical crisis, to actually be able to take them to a mental health crisis center as opposed to the hospital emergency room, where they sit and are evaluated for their physical needs, and then oftentimes stay in the emergency room until they can somehow get to where they need to go. There have been pilots in a number of places in the state, and they're working well.
If they can find a mental health crisis center.
Well, that'll be the next thing.
Well, thank you for watching the Afterspin. We'll have more video all during the week on ncspin.com.